views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and their respective stations.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. As we get you going on the weekend, each and every Friday and Saturday we get together and we talk about all things related to your health, compliments of our friends over there at the HSA. And this time we are getting into the month where we want to talk about bring awareness to Alzheimer and brain awareness. Now, when you say brain awareness, in fact, let me introduce my guests. Go ahead and introduce yourselves.
Is it going to be a morning or an afternoon?
Yeah, afternoon.
Good afternoon, Chuck. My name is Dr. Tamas Cseh. I'm a consultant neurologist for the HSA.
Hello, good afternoon. I'm Camille Marshall-Morris. I'm a neurophysiotherapist here at HSA Therapy Services.
So when we talk about Alzheimer and brain awareness, how do they relate together? Because you usually hear Alzheimer and you think, okay, the brain is missing things, it's not functioning, but then brain awareness, what does that consist of?
As you know, Chuck, there are several hundreds of different types of brain diseases. And there is a specific group of brain diseases called the neurodegenerative diseases, where cells in the brain just die off. We don't know really why. And the most common form of that is Alzheimer's disease. Other diseases in this group include Parkinson's disease, Huntington's disease, ALS, motor neuron disease. Mm-hmm. And the reason why we have the Brain Month is to make the public aware of these very serious conditions and to educate the public and how to recognize them and how to manage them.
Over the course of time, we keep hearing them individualize. You rarely hear them grouped together. You'll hear people say, this person has Parkinson or this one has Hunter, but they all really stem from brain disorders and stems off of that.
Exactly. So the whole point of all these neurodegenerative diseases is that certain cells, certain brain cells die uncontrollably and relentlessly. Mm-hmm. In Alzheimer's disease, this happens in the memory center in the brain. This is why you have the memory issues in AD. In Parkinson's disease, it's the movement center in the brain that gets progressively less and more atrophic. So it's kind of the brain shrinks in that part. And all the different neurodegenerative disease, as you say, stem from the same problem. These progressive brain cell loss in specific regions in the brain.
Okay. And, and for I guess the general public, over the last, I want to say, 2 or 3 decades, it has become more normal that we hear and talk about this. A lot of celebrities have come to the forefront. They're operating and basically living with these degenerative scenarios. But before, we never really heard of them too much, unless, you hear celebrities, Lou Gehrig, and, things of that nature. But now it's becoming more commonplace for people to come out and talk about this.
Absolutely. If you think of Hollywood celebrities, everybody knows Michael J. Fox, who has young onset Parkinson's disease, and he has a tremendous charity, the Michael J. Fox Foundation for Parkinson Research, and his charity has contributed massively to the research in Parkinson. But you might remember Robin Williams.
Yes.
He had Lewy body dementia. You might know Bruce Willis. He has frontotemporal dementia with what we call progressive aphasia. And he and his family have been very open about it. So I think this is very important because, this helps to kind of destigmatize this group of diseases.
Right. Over and just being in the media, this has been one of the things that when people had this happen in their lifetime, they kind of just put away, so you didn't really hear about it. You didn't hear of them, seeking therapy and going into, and being more of a working relationship with the hospitals and doctors and things of that way, which brings me to Miss Morris. Miss Marshall-Morris. Tell me a little bit about neuropsychs. How do you pronounce it?
Neurophysiotherapy.
Neurophysiotherapy. We've heard of physiotherapy before, but this is something new that we're talking about, at least in my realm. And tell me a little bit about that.
Okay, so neurophysiotherapy is a little bit expansive in terms of how we look at the overall assessment and looking at goals for patients, which are, again, based on neurological disorders that may be due to either trauma, whether it's a stroke, or as Dr. has indicated, it's a long-term debilitating process. So their therapy may not be in and out in like 6 weeks, like a MSK patient who has just had a sprain or injury and they're back on their feet without any long-term, per se, affectations. But for these particular patients, they have challenges in terms of performing everyday function, bathing, dressing, feeding, balancing, walking independently. And how the disease progresses, it usually progresses to the point where the person loses more independent function over time. It may be years, it may be months, based on where we get them on the initial assessment. And the management is a more considering all those aspects, looking at in terms of even just care, the support they have in terms of performing everyday activity, their occupation. A lot of these things are now going to be looking at not just managing the patient, but treating the whole family and support system to know how to care for them at each stage of their disease.
Exactly. I was, while you're talking, my brain is clicking, saying, what, as it gets less and less normal, because I don't want to say any, because you're not functioning as you normally would. The family or your network needs to kick in and be aware of what's going on in the phases and steps of that. That's where you come in?
From the get-go, because, again, we also have to get the patient, to get on board with what needs to happen, what their diagnosis means, and so they can buy into what we're doing, so they, they can participate more fully and engage all our processes to get the best outcome overall. So we want them to be able to know what's happening early, to minimize refusal, because initially may have an issue with just a little balance, and we say, okay, we have assessed you, we need to get you safe with walking, you may need a device. Sometimes they refuse. I don't want to be walking with a cane.
Yeah.
But we say, okay, we can defer how soon you need to start using it if we can get you strong or get you in a program now to build your strength up, to build your balance and flexibility up. So the likelihood of you getting into the need of these devices for support and is further back.
Right. And, this is something, and folks, if you're listening to us, we're talking about Alzheimer and Brain Awareness Month. This is something that happens over gradually a period of time. So people say, I'm losing my balance. I may just feel off this month, but there is a definite degenerative part of it that's going to continue on. It's going to
progress, yes. And again, the treatment will be geared to how they present, whether we get them in the early stage when they're still fairly maintain most of their function, or we get them in the middle stage when they have some losses, or at the very late stage, or thinking about preventing the more life-threatening conditions like a pneumonia or a bed sore and stuff like that.
And I think that is a great point that we need to take a look at, is the fact that based on that, it's going to get to a point that you're really going to have to be careful of everything that you're doing. And definitely. I think, over the course of time, we've watched people who've had these disorders, and I want to say disintegrate fast. They said, okay, I'm here, but it was never diagnosed early. And then all of a sudden, within, 2 or 3 years, they cease because everything has really falling off really fast.
But it's the good thing now, we have a very comprehensive team, including speech, including occupational therapy, and ourselves who, as physiotherapists, who can assist the patient at each stage, where you can get devices. We can teach them how to mobilize safely, to maintain a lot of the independent function that you want them to maintain as long as is possible, and that overall can give them a better quality of life. So it's not just okay, as you said earlier, putting them back and just waiting for the day. It's more like engaging them early, as quickly as you can, and to do moderate intensity level activity and exercises to maintain their strength, to maintain flexibility, to maintain balance, so that the progression is slowed
down as much as you can possibly do. Folks, we're going to take our first break. We're here talking about Alzheimer and Brain Awareness Month. Don't forget our friends here graciously from HSA are stopping by here. I'd say, I'm going to try to pronounce it, Dr. Cseh.
That's close enough.
Close enough. Okay. And of course, our neuro-physiotherapist. And I'm getting it, Miss Marshall-Morris. Thank you so much for stopping by here. We're going to take our first break and come right back. And we're going to talk about some of the primary risk associated with Alzheimer's. And we'll be kind of diving a little further into the idea of what it takes to assess this, and also moving forward with it. This is Healthcare Today with the HSA. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday at 1 p.m. we get together and talk about all things relating to your health. This time we're talking about Alzheimer and Brain Awareness Month that's going on. And I want to say this has been a talk that we've had a little bit before, but we never really kind of dove into it because we talked on a broader base. So I wanted you, Doc, to give me some primary risk factors when it comes to Alzheimer's.
Yes, so the most obvious risk factor is age. As we get older, we have an increasing risk of developing AD. So typically it develops after the age of 65. And as we get older and older, this so-called prevalence increases. It doubles every 5 years. Mm-hmm. Of course, we cannot really do anything about it. And the other thing that's not modifiable are the genetic risk factors. So we now understand that there are certain genetic variants that does not cause Alzheimer's, but it makes you prone to develop it.
More susceptible?
It's more susceptible. If other environmental factors chip in with the genetic together, they can present as late onset Alzheimer's. So these are the non-modifiables. However, there are some modifiable risk factors. One of this is, interestingly, cardiovascular disease. So uncontrolled hypertension, diabetes, high cholesterol have all been shown to increase the risk of developing Alzheimer's in late life. Another important risk factor is lifestyle. So a lifestyle, let's go to obesity, no physical exercise, sedentary lifestyle, smoking. So these things we generally call, bad lifestyle choices actually increase the risk of late onset dementia as well. Other risk factors include repeat head trauma, like the football players in the U.S. There's a clear association with that. Chronic depression also increases the risk. And generally speaking, like social isolation and detachment in the elderly is also a risk factor.
Really?
Yes.
So,
yes.
You brought up a couple of things that I'd like to kind of talk a little bit more about. One factor is certain things are modifiable. Certain things we can control.
Correct.
To help lower the risk of this developing at a later stage.
Yes.
Folks, I can't tell you, smoking, please cut it out. Seek help. HSA have a great program that's there to help you quit smoking, the Sensations program. Please reach out to them. And also, you talked about trauma from sport injuries. We don't have full contact sports here like the U.S., but that is one of the, if not the number one sport. Football, they start that at age 7 and 8. Full contact. I've seen them, hitting helmets, knocking, that can increase the risk?
Yes, especially it started early. So, the developing brain doesn't like repeat blows to the head. So it has been shown that repeat head trauma over and over again for years increases the risk of Alzheimer's, of Parkinson's, and all kinds of neuropsychiatric issues, behavioral problems, depression, and stuff like that. And, a lot of these players have died over the years, obviously. And the autopsy showed that they have very, very similar changes in the brain as those with Alzheimer's disease. It's pathologically, it's a separate condition, but it looks exactly like that.
It looks like exactly the same. And folks, makes me think of, the growing sports of, that full contact MMA and the boxing and all of those. Those really are head traumas, because you're getting hit repeatedly over several years. That must have some declining on the brain function.
So if you cause repeat trauma to the brain, the nerve cells as well as their axons, so the wire that comes from the brain cell, they get concussed, they might get damaged, they might get cut in half, and these little traumas, they add up over the years. It's kind of an accumulation of these small traumas.
Concussions.
Repeat concussions, stuff like that in boxers, as you say, and that kind of adds up. And at the end, you have the neurodegeneration.
Wow. And these are things that we're talking about are completely controllable, that we've just mentioned. These are things that you can avoid. These are things that you can stop. These are things that you don't need to be available to do. But now we talk about dieting. Our region, I love my West Indian. I love us eating, but, we tend to eat the more fatty foods, the more oily food. Hypertension is very much a question in our region. These are something that we can modify also?
Absolutely. So diet, I'm glad you brought that up, because it's one of our main modifiable risk factor and way of intervention to help prevent not just Alzheimer's disease, but cardiovascular disease in general and neurodegenerative diseases. It's called the Mediterranean type diet. So it's a lot of fish, lean meat, fruits and veggies, whole grains, nuts, and little to no sweetened beverages and ultra-processed foods. I don't want to say zero, because...
I'll save you from the... Folks, try to stay away from the canned sodas, from those modifiable drinks that literally is you... I tell people, I said, you want to see what sugar looks like? Look at a can. It's literally sugar and water, and they just shake it up and add a little food coloring into it, and that's what you're gonna, I mean, if you put it down, some animals won't even lick it. so why are we drinking it? I'm just tossing it out there, folks, calling it like it is. We want to give you better alternatives, better options, and that kind of brings me to the next kind of idea, like early signs of it. We talked about the neuro part of it, not being able to walk, slowing down speech. How is that so quick to kind of give you indications that something is going on?
From a physiotherapist standpoint, we may see them after the doctor has picked up on some issues, or we may have them in for some other condition and we notice that they're having challenges finding words or completing sentences, or the family member will indicate to us that they're having some challenges and they're not sure what's happening, and they're maybe in for another type of injury or condition, and we have to say you need to go follow up with your physician, and then they may do some additional tests and measures, and then refer to us. But usually they don't get sent to us unless they're beginning to have motor challenges where the movement is a little bit off, or they're unsteady, or that's when most times we will get them. They probably will get to like the speech therapist a little bit earlier if they're having like issues finding words and so on.
Right. So it's usually something that leads you to make that assumption that they need to see the GP and
follow up with a specialist.
With a specialist from there.
Yeah.
Exactly. And I think that's good to know that your staff and that side of it is trained to recognize some of the early stages to be able to help.
Send them back,
because maybe they
workup.
fell down and broke their arm or something, and you're
But because they were having balance challenges.
because they were having balance problems, but they didn't pick up at that point. It was just an accident, and then you have a conversation, and then you realize.
Yes, that's definitely what usually happens. They're in for some other type of injury, or a family member maybe coming in for treatment for something and said, oh, I noticed this, or they may see another patient being managed for something that looks like their family member. Say, okay, do you guys treat for this as well? I said, yes, but issues with that, but you definitely need to see what's going on, with that patient, specifically with the doctor, and then send back. Yeah.
Which kind of slides into my question, Doc. The early signs of specifically Alzheimer, and how do you see it, and how is it diagnosed?
That's a difficult question because you have to be able to differentiate normal aging, normal forgetfulness versus Alzheimer's disease, early Alzheimer's disease. Sometimes it's difficult to make that differentiation. Generally speaking, Alzheimer's disease primarily affects the memory, specifically what we call episodic memory. So things that when it happened, you have a relation to it, like, oh yeah, last week I spoke to that guy, or what I had this morning for breakfast. So episodic memory is the memory we have that is kind of associated with certain places, times, and people. And this is what gets impaired early on in Alzheimer's disease. So in practice, this means, the patient starts forgetting recent events, recent conversations. Oh yeah, we discussed this. We just discussed this 10 minutes ago. Why are you asking this again? Stuff like that.
Kind of short-term memory.
Yes, or recent memory.
Recent
memory.
Right.
Names and faces, facial recognition. And as the disease gets a bit progressively worse, patients might struggle to make decisions, to plan, for instance, manage their finances, paying the bills, paying with their card. They struggle with these basic daily functions. They can also have language problems, for instance, finding words. They can't remember certain simple words. And again, it's difficult. Sometimes it can be difficult to tell whether this is normal aging in a 75-year-old or is it pathological. And the way we try to tell them apart is we ask the patient and we ask the family, are these issues severe enough to interfere with your daily activities, your quality of life? And if the answer is yes, then it's probably AD or some variation of that.
Yeah. So
can I add some of the things I've seen? Some patients have commented, or family members. They say, she was supposed to take her medication and she didn't, or she put something on the fire, it got burnt. She forgot to go back and tend to it. So these are some of the examples that I've observed.
Real life scenarios. But when you talk about that, it's really kind of scary and life-threatening that we're talking about. Even though it's in the early stages, forgetting something like cooking could burn down the house.
Yeah.
Forgetting medication may cause an episode of bigger proportion that we're talking about. Yeah. So it's really, really kind of critical that after the age of 65 that we kind of really pay close attention to our relatives or even ourselves to make sure that we're kind of understanding what's going on.
Totally. So that's one of the big issues, and this is why we have this whole month, to raise awareness and to diagnose early, because even though we don't have a specific medication we give that will make it go away, we can adapt to the situation. So we can arrange a caregiver who looks after the patient during the day, during the night, etc. And we can make all the necessary arrangements and adjustments in the patient's life to make sure that both they and their family is safe.
I think that's really a good point that I like. The quality of life from diagnosis to care. I think that's really where you kick in the daily aspect of the lifestyle.
Okay, in terms of even the care, before you even need to get somebody in the house to kind of observe, based on the severity, for some persons, just using technology to assist clients to remind them about certain things they're doing, or just to create a routine, in terms of the activities they need to complete, to just put it in a way that they can actually easily do smaller tasks. Like if you were training a child, you break it down into simpler, progressive steps so that they're easy to follow, setting prompts on your phone or for the person so they can remember, go take your medication now, or a family member kicking in, even if you're not at the home, to say, okay, to double check, did you take your medication? Look, so it may not necessarily need the full in-house carer initially, but those setting up routines for them and using technology to set, before they actually need to get somebody in-house to do stuff like that.
I think that's really good for our listeners to understand that, the earlier you start a regimen and a routine, the better the outcome can be based on that. Because, when you think of it, we set things to remind ourselves now, even in our 30s and 40s and 50s. So technology should be helpful for them at that age. Yeah. Plus, that older generation is very fiercely independent.
Yeah. They don't really want anyone in the house too soon.
Nowadays, and I say our age group, but my age group don't mind, someone walking with them across the street if they've hurt their leg or something like that. But that older generation is fiercely independent. They will rather not have it than ask for help. Mm-hmm. And I think that is one of the things that we need to recognize, that to help them stay independent as long as they can, that these regimens and these routines are vital.
Sometimes making activities simpler in terms of the processes, even dressing, choosing up, items that are easy for them to, sort through and organize on their own, versus making it too complex. In terms of eating, if they don't need multiple things, and just keeping the meal simple, that they can manage, right? So in terms of, again, it's about maintaining independence and that quality of life where they feel like, I'm my own person, I can take care of myself. So all the activities that we do is geared to getting them to that place where they can maintain that level of independence as long as possible, within those safety margins, of course, for themselves and for their families.
So I'm going to ask one question before we take a break. Treatment could be short, could be long. It's individualized. Tell me a little bit about that. Before we take a break, just give me a little bit of that.
Okay. So the treatment, again, is based on what phase or stage of their condition you get them in. And again, treatment may be extended over years based on, again, when you actually start with them. And it doesn't mean that they're in session for years continuously. There may be a break where if they have areas of deterioration, they'll come back in and we'll start a new set of, protocols and treatment implementation strategies that may be useful at that stage. But maybe initially they're not much weak than a normal person, in terms of they can follow instructions, they can be given a program of exercise for balance training, for flexibility, which they will carry out on their own. They are given a proper home program that's supervised by their carers. If there are any challenges, they always can come back and we tweak their program for them. Those who need a little more consistent supervision, who will benefit from what we call cross-training, then we'll look at like dual task training, which also help cognitive skills, also help with increasing oxygen support to the brain, which also helps delay the progression. So you're looking at programs that is going to increase that level of fitness, strength training, flexibility, balance. All those would be applicable in the first and usually the middle stages. And then usually towards then, as we feel it not coping with that program, will me want to tailor something more specific in terms of identify the needs within the home, that they can continue within their abilities.
Okay, excellent. We're going to take a quick break, folks, and come back. We're talking today about Alzheimer and brain awareness. It's all of this month. We're talking about celebrating it and making it aware that people in our community, because remember, we're talking globally, but in our community, this is definitely something that is going on, and we need to be aware of it. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendinitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together at 1 p.m. and talk about all things relating to your health. And this month is all about Alzheimer and brain awareness. You know, I say the start of the summer is always the hot time and people are always out and about. And, you know, I tell people, stay hydrated, because one of the things I hate to see is when people get overhydrated, they get these headaches and all of this stuff, and strokes and things like that happen. The highest part is early in the summer. I will tell you, and I had to look this up. I did my little studying before it, because people tend not to make that transition from that spring to summer thinking that, oh, it's cloudy outside, it's not hot. And all of a sudden they have overheating days and things of that nature, which we will be talking about later on in another episode. I will get to that. But we want to access Alzheimer and Brain Awareness Month. What does treatment look like in 2024?
Unfortunately, we don't have a curative treatment, as in there is no medication that will make it go away. We have therapies that can help with memory in the first couple of years, and in the later stages of the disease where behavioral problems, behavioral challenges become an issue, aggression, confusion, sundowning, all these psychiatric symptoms, we have medications for that as well. So initially, what we tend to do is we give a medication, either donepezil or rivastigmine, which are essentially, patients call it memory tablets. So it's effective in mild to moderate Alzheimer's disease, and it kind of helps cognition, helps thinking, helps speech, helps memory, but unfortunately it's not magic. So usually its effect kind of fades away in a year or 2 or 3, and as the disease progresses to moderate to severe AD, we use a different medication called memantine, which again is a memory pill, but it also helps with behavioral challenges. And there were a few studies recently, well, quite a few actually. So the newest drug we have was FDA approved, I think, in 2002. So we haven't had anything since then up till recently, where there were 2 so-called monoclonal antibodies, so injections, approved by FDA. But unfortunately, one has already been withdrawn due to severe side effects and not excellent efficacy. And the other one is also, it hasn't lived up to its promise, I'm afraid to say. So my point is, there are extensive research as we speak here now into Alzheimer's disease, into new treatments in Alzheimer's disease, but unfortunately we don't have the magic bullet as of yet.
Okay, which I wanted to just shift gear a little bit and say time consumption of information for Alzheimer. Does it make it that more challenging trying to find a better treatment for it?
So the problem with Alzheimer's is the same as with all the neurodegenerative diseases we spoke about earlier, and that is we don't know the cause. Okay. If you don't know the cause, you won't be able to treat the cause. So all you can do is manage the symptoms, which these drugs do.
So if I have a broken arm, you know how I broke my arm.
Exactly.
You fix the broken arm.
Exactly.
But this you don't know.
We don't know. If you have a chest infection, we give you antibiotic and you go home. But imagine if you had a chest infection because of a bacteria and we didn't give you antibiotic, we would only give you paracetamol to reduce the fever. That wouldn't cure the disease. It would just manage the symptoms a little.
Right.
So it's the same with all the neurodegenerative disease, Parkinson's, ALS, Alzheimer's, that there are processes in the brain which lead to brain cell death, which we see, but we don't understand what sets it off. What's the root cause of neuronal cell death? And I'm afraid that until until we don't find out what the actual cause is, we won't be able to treat the cause.
Difficult to pinpoint because we're talking reality. There are so many avenues that we're talking about here that maybe one can help one way, but then in another patient it doesn't have the same effect.
Exactly. Not all patients are the same. And the other interesting thing is what we call resilience. So sometimes in 95-year-old patients we see who don't have dementia, but they have the exact same changes in their brain as patients who died of Alzheimer's.
Wow. So in reality, you can literally have the same medication, same disorder, and have different outcomes based on the person's neurological makeup.
Absolutely, absolutely. And this is where what we call precision medicine or personalized medicine is going towards, to treat every individual as individuals and treat them according to their needs, according to their genetic profile, to their liver functions, etc., etc. We're not there yet, but this might be the future, actually, yes.
And with that being said, what role does neurophysiotherapy play with that? Because the management has to be different based on that.
Because again, what you're assessing for is every individual client who comes in, you have to identify their specific challenges. When you do your test and measures, everybody's final scores on different aspects will be different. So you do like a Berg balance assessment on one patient, they may score issues may having to do with single leg standing or changing directions quickly. Another person may have other types of challenges with transferring from a bed to a chair. So every patient, you have to treat their specific challenges and address what's contributing to their deficiencies or their inability to complete that task. So again, it has to be tailored to that individual, the assessment and the treatment.
But based on that, is there something that's more common physical challenges across the board?
Most times it has to do with coordination, balance most of the time, and diminishing strength. So their overall, core strength, lower limb strength usually is declining, and they're having, because of the losses in strength and coordination, they're having problems with their balance and their stability and then overall endurance. They'll get tired easily, and so they may not want to be out and about doing much, so they again become more sedentary, which you don't want.
Right.
You want to get them to stay active.
Need engagement and movement.
And again, as you mentioned, the socialization, also getting them to come back to a group setting. Again, they may shy away because of issues with speech and not feeling the need or the ability to communicate easily. In those cases, you want them to engage with a group class necessarily, and kind of build back those skills or maintain.
Those motor skills need to be exercised,
yes,
to keep building.
Yes, and to keep them at a level as long as possible. Mm-hmm. Yes, so the social engagement does help with that as well.
Excellent. And would you say that because of that, family members need to support the communication with the healthcare provider and the doctors?
We always encourage that. Most times they are present during the assessment. We discuss home programs right there and then. Sometimes they are unsure as to how to mobilize their family member based on what timeline we get them in, and they have challenges in terms of how to transfer them safely, how to move them from point to point, how to get them to get dressed easily, and we have to walk them through what they can do. And sometimes they're surprised because, I didn't know she could do that. I didn't know he could actually get that done. And said, yes, you just have to instruct them. Mm-hmm. Sometimes just give them some safety precautions so they're not pulling on limbs that may cause irritation to susceptible joints, or making sure that the skin is, intact and they're not staying in one position too long. So make sure their alignment and their posture is maintained in ideal positions and stuff, and show them how they can replicate what we do in the office at home as well to keep their members
it's
safe.
A kind of a 360 treatment, individualized from doctor to the neuro part of it, and also the home part of it.
Yes, that's where the OT would come in as well. And sometimes they have to go in and look at what's happening in the house, how their bedroom is set up, the heights from if they have to be in a wheelchair to transfer across, make sure the heights are properly adjusted, that there's an appropriate type of seating surface for long-term seating or for transfers or for mobility activities. Mm-hmm. They look at everything, bath setup, how do they do it at home? Sometimes what we see in the clinic is that's not what's happening at home.
Right.
They're doing their own kind of, tweaking some stuff around to get it done, but it's not the ideal. And if we know what's happening there, so the OT will go in and see what's happening. And maybe they have issues with the width of the door. They are limited to one room. They can't travel through because there's furniture in the corridor and we need to move that out of the way. Sometimes there are throw rugs on there. There's not enough lighting. They can look at all these dynamics and see how best they can make things easier for the persons in the home and ensure they're safe.
It's a lot to take in. Mm-hmm. It's a lot of moving parts there. We're going to take a quick break and come back and we'll wrap up. I'm going to ask them the big question before we get out of here. We'll be back in 2 minutes.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with HSA. I'm Chuck Taylor, and with me, we're talking about Alzheimer and Brain Awareness Month.
Dr. Cseh?
And Camille Marshall-Morris.
So before we wrap up, if somebody has just been diagnosed or some family member is going through this, what advice would you give them? Seeing that the month is to bring awareness to it, what would you tell them moving forward?
Yeah, so first of all, it's always a shock to get this diagnosis, both for the patient and for the family. So, of course, we need to give time for it to sink in, to accept it. I tell patients that, it's not the end of the world. It's a disease that can be managed appropriately, like we talked about. And I also try to emphasize the carer's responsibility and the difficulties that they go through. So usually the main carer is a spouse who are similarly aged, 70, 75, 80. And if you imagine that one day your spouse you've been living with 50 years don't recognize you anymore, that's a catastrophe. Yeah. But then you have to be really empathetic and explain to the spouse that, it's not that they don't like you or they hate you or anything like that. It's part of the disease, unfortunately. And sometimes we need to give psychological help for the surroundings, for the environment, for the family, for the spouse, for the children, because it's very difficult to accept it. But I think once we're through that initial phase, we can work together with the GPs, the allied healthcare professionals, with the family to manage the symptoms as best as we can and to improve quality of life, which is our main focus.
Okay.
So in terms of caring for these patients, once they're able to accept what we're working with and challenges their family member may have, we realize that we treat the entire family. It's not just the patient, because most times the patients are fine in the sense that they'll cope with what's happening, but sometimes the family members are the one who are breaking down. You know, they don't know what next to do. They are unsure what steps to take, how best to care for their family member. And once they are aware of what strategies they can take to care for them safely, to keep them comfortable, most of the time they are concerned that, am I doing enough? And maybe I can't do it all. And once we give them the resources they need as to where they can get the support, if they need a break, you know, where they can get people who are trained to assist them in the home. If they need that support, when they need that, they know where to get the help they need. So they're not feeling alone and disconnected, and even just keeping them a part of what's happening, the progress, and seeing how much they can retain, you know, the quality of life of their family member with the activities, with the exercises, with everything. They are, you know, they appreciate all that input. So it's not to sit up in a corner and stay back, but to come forward and get the support and help that is available. You know, for most times they don't know that help is available.
Right.
And support and, you know, care is there to keep them, you know, enjoying their family member for longer periods before they get to that stage where they're, you know, not recognizing anybody and dependent. It may be years before they get to that point, but so they can enjoy this by giving them the support and the resources they need to keep moving forward on that.
Excellent. Folks, and there you have it. Compliments of our friends over there at the HSA. Great information. Thank you both for stopping by here. And don't forget, folks, we're all talking about Alzheimer and brain awareness all of this month and all during the year, but specifically for this month. Thank you so much for stopping by.
Thank you very much.
You're welcome.
Excellent. Keep it right here. This is Bobo 89.1 FM.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.